Well, I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So we'll have Dr. Rose Molina, who is the core faculty member at Ariadne Labs and also an obstetrician gynecologist at Harvard. We're going to move into this presentation by Dr. Rose Molina. So you've heard a lot about the Safe Childbirth Checklist today and this wonderful launching of the relationship between CAHO and ARCOG, among others, to support checklist use. Dr. Rose is going to share with us about implementation, what we've learned about strategies to improve it. And so Dr. Rose Molina, I'm going to turn it over to you.
Thank you so much. It's so wonderful to be with you all in celebration of World Patient Safety Day and this year's particular focus on safe maternal and newborn care. The driving motivation behind the WHO Safe Childbirth Checklist, along with other patient safety tools, is to address the no-do gaps in childbirth care. These are the gaps between what we know and what we actually do. Globally, poor quality of care causes more deaths than insufficient access to care. This failure to equitably provide quality and dignified care to everyone, everywhere, is healthcare's biggest cause of suffering and death, and our biggest challenge ahead. Our organization at Ariadne Labs was a critical partner in the development and evaluation of the WHO Safe Childbirth Checklist. Founded in 2012, Ariadne Labs is a joint center for health systems innovation at Brigham and Women's Hospital and the Harvard Chan School of Public Health. The World Health Organization's Safe Childbirth Checklist was developed in 2009 and publicly released in 2015. It was designed as a patient safety tool to ensure the key practices are done during every childbirth to prevent the leading causes of maternal and perinatal death. The checklist is divided into 4 pause points: on admission, just prior to pushing or cesarean, 1 hour after birth, and on discharge. Ariadne Labs was a leading partner in the Better Birth trial, which took place in 120 primary level facilities in Uttar Pradesh, India. In the study, we tested an 8-month peer coaching program with data feedback to implement the WHO checklist. This study is one of the largest studies in maternal newborn health ever conducted, with around 160,000 woman newborn pairs and over 5,000 direct observations of births. Notably, in the primary level facilities where the study took place, the cesarean delivery rate was only 1.8%. We found that the Better Birth implementation of the WHO checklist, coupled with coaching and data feedback, dramatically improved adherence to essential birth practices. Yet these improvements were not sufficient to reduce overall maternal and perinatal mortality in the primary level facilities at scale. We realize that behavior change is critical to improving quality of care, but high levels of sustained behavior change require additional systems improvements that were beyond the scope of the Better Birth trial. At the end of the Better Birth trial, we had over 300 million data points to better understand the ecosystem of facility-based childbirth, which includes the woman and her community, the birth attendant, the facility, and the health system. Since we published the Better Birth final report in 2019, there have been several studies that have demonstrated the impact of the Safe Childbirth Checklist on perinatal and newborn outcomes when it was implemented with other quality improvement initiatives. Specifically, in Rajasthan, the Safe Childbirth Checklist was implemented with monthly coaching visits and supply chain support, which resulted in an 11% reduction in neonatal mortality. In Uganda and Kenya, a package of interventions that included a modified Safe Childbirth Checklist, data strengthening, quality improvement collaboratives, and simulation team training all resulted in reductions in perinatal mortality, fresh stillbirth, and 28-day neonatal mortality. In 2020, we set out to understand the state of the checklist implementation experience around the world 5 years after its public dissemination in 2015. We gathered data through a literature review, followed by a survey of implementers of the checklist. We analyzed responses from 29 implementers. This map shows the respondents' countries where the checklist was implemented. We also conducted follow-up in-depth interviews with 12 implementers. Over 90% of the survey respondents reported that they adapted the Safe Childbirth Checklist tool itself. The adaptations included changes to both structure and content. With regard to structure, as you can see listed here, there were changes to the form and changes to the function of the checklist. With regard to content, there have been adaptations to include changes to clinical content based on the context and management items that have been added. We asked survey participants about the implementation activities listed in each of the phases of the WHO implementation guide, which are engage, launch, and support. In the engage phase, many respondents reported that they adapted the checklist and met with stakeholders, but fewer respondents established an implementation team or created a system for supportive supervision. In the launch phase, many respondents reported including a technical training as part of their official launch event, but few respondents reported applying the checklist framework to antenatal care. In the support phase, many respondents used coaching, shared feedback for improvement, and documented successes and challenges with the checklist. Yet few respondents reported assessing the availability of essential resources. The top 3 barriers to implementation were all related. They were skepticism about the importance of the checklist not being integrated into the routine workflow, and the checklist being perceived as burdensome. Based on our data and work with implementation partners, we developed promising practices about the checklist adaptation and implementation. In the pre-engage or design phase, some promising practices are to clearly state the purpose of implementing the checklist and the targeted outcomes for change, to maximize user friendliness of the checklist, to conduct a needs assessment, and to define the complementary bundles and tools that are needed to support the checklist use. In the engage and launch phases, ongoing leadership support and engagement with all facility staff are critical in showcasing the value of the checklist and everyone's role in its success. In the support phase, it is important to identify strategies to motivate behavior change, to infuse safety, quality standards throughout all work, to strengthen the referral system, and to stabilize funding for the Safe Childbirth Checklist. In the measurement phase, it is important to analyze and disseminate data regularly to all staff in a constructive way. In summary, we found that key principles around adaptation to local context, leadership buy-in, stakeholder engagement, and field testing resonated across implementation settings. Yet we heard that there was a persistent discrepancy between the optimal enabling environment and resource constraints in supporting the checklist use. Additionally, the WHO Safe Childbirth Checklist Implementation Guide could be improved with greater specificity for addressing challenges and implementing the checklist in a variety of contexts. So what's next for the checklist? A fundamental question still needs to be answered, and that is, what are the optimal adaptations and implementation pathways to impact maternal and newborn outcomes in a given context? To achieve this, we have charted a path forward for donors, ministries of health and policymakers, clinicians and implementers, and researchers. They all have critical roles to play in shaping the future of the Safe Childbirth Checklist. Thank you so much for joining this event in honor of Patient Safety Day. I look forward to hearing from our panelists, and we'll turn the conversation over to Dr. Katherine Semrau.
Thank you so much, Dr. Rose Molina. This is great to hear, just a grounding so we all have a common understanding of what the WHO Safe Childbirth Checklist is and how it can promote safe and respectful care for maternal and newborn health. One of the key questions that we've heard is, what is the integration, or is there integration between this WHO Safe Childbirth Checklist and the WHO Safe Surgical Checklist, which could be used during cesarean delivery? Dr. Rose, I'm going to come back to you and ask you to share your reflections, and then we can see if others have thoughts.
Great, thanks so much for this question. It's a really great one. And just to give a little bit of the history of the two tools. So our founder at Ariadne Labs, Dr. Atul Gawande, was an instrumental leader in developing both of those tools. And as I mentioned, they both come out of the patient safety movement to really close the no-do gaps in healthcare. And as you know, the Safe Surgery Checklist is to ensure that the key practices are done for every surgical procedure, with an emphasis on team communication between the surgeon, the anesthesiologist, the circulating nurse, and the scrub tech, to ensure that all the safety practices are done for every patient every time. A similar principle was used to develop the Safe Childbirth Checklist, and it's a little bit different in the sense that, as you know, childbirth is a little bit more complex and can last much longer over the course of up to a couple days rather than one defined scheduled surgery like the Safe Surgery Checklist. So it has more elements to it and some more complexity. But the general principles underlying both of them are the same. As was mentioned earlier, there has been a huge focus on adapting both of the tools to a local context, and that might include national guidelines and prevalence of particular illnesses or diseases that might need particular attention in the checklist based on where you're practicing. Those are all things that are encouraged. Specifically for the Safe Surgery Checklist, there have been many sites that have adapted the Safe Surgery Checklist for cesarean delivery. As you all know, cesarean delivery is the most common surgery done worldwide. And there are really some unique aspects of cesarean delivery that I think really differentiate it from other surgeries. And this is me speaking as an obstetrician gynecologist and certainly biased about cesarean delivery, but I think of it as an exceptional procedure, not only because we have two patients, we have the mother, we have the baby. There is also a huge amount of potential for blood loss, as you all know, in terms of preparing for hemorrhage, which is the #1 cause of maternal death. So and of course, we have the placenta and other factors that are specific to cesarean delivery that require particular attention in terms of coordinating teams around both the mother and the baby, and then also preparing for complications. So many sites have actually adapted the Safe Surgery Checklist specifically for cesarean delivery. And there have been some sites that have even integrated that into their Safe Childbirth Checklist, recognizing that the Safe Childbirth Checklist, as it's designed, is more around labor management and newborn resuscitation, but doesn't go into the steps or the key practices for a cesarean delivery, if a cesarean delivery is recommended. So to answer the question, there's certainly room for adapting both tools and that they can really be used in harmony with each other, given that many women may end up needing a cesarean delivery for a variety of reasons. And the underlying principles of both tools are the same, but do require local adaptation.
Thanks so much, Rose. I really appreciate that. So, and I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. You know, it's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey. And we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today. And next year, let's all meet together and see the success and where, after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.